A 45-year-old woman went to see a chiropractor for her back pain. She was recommended to try megavitamin therapy. This is what happened to her kidneys and bones. In 1985, DL, a 45-year-old woman, presented to the Columbia Presbyterian Medical Center with anorexia, an orange hue on her skin, and a broken leg. But she was told to wait as she was given low priority by the hospital staff. However, after some time in the waiting room, she starts to lose consciousness before slipping into a coma. This is when the hospital staff realized that the broken leg was just one of the symptoms of a more serious issue. You see, earlier that year, DL went to see a chiropractor for her back pain, and while back massages and bones cracking didn't really help her, the chiropractor had an idea. DL, you should try a megavitamin therapy, he says. DL never heard about the megavitamin, but since nothing else worked for her back, she decided to give this new therapy a try. It's just vitamins, and vitamins are good for you, she thought. What could possibly go wrong? And at least for a while, the megavitamin therapy worked. She had a huge improvement in the intensity of her back pain. But that wasn't going to last, unfortunately. Just a few weeks after starting the therapy, DL began to lose weight at an alarming rate. Her belly, however, started to look swollen. And then her back pain came back with another symptom. That morning, she woke up too early again because she needed to go to the bathroom for the 5th time after going to bed. But what worried her even more was her skin. It was almost completely orange now. How could I have not noticed this? She thought. This is when she starts to get really upset. And while her husband, woken up by all that commotion, tries to calm her, DL trips and falls, breaking her leg. Gathering here, what I have for you today is a cautionary tale. This story is based on events that actually happened and that were documented on medical journals. And it's all about the single most dangerous vitamin you should never supplement. Seriously, don't supplement anything without talking to your doctor. So the question is, do you know which vitamin is the most dangerous to supplement? Now, the assumption here is that you should never supplement any vitamin without a specific need, especially if you have kidney disease, diabetes, or another diagnosed condition, especially not in high doses. Because while vitamins may be extremely helpful if supplemented correctly, all supplements have some inherent danger. And there are some vitamins that are more dangerous than others. You see, there are two kinds of vitamins. Those that are soluble in water include vitamins of the B group and vitamin C, and those that are soluble in fat, including vitamin A, D, E, and K. While water-soluble vitamins are immediately excreted by the kidneys, when taken in too high doses, fat-soluble vitamins can accumulate in your body's tissues. This makes them dangerous when taken for too long periods of time or in too high doses. And one of these vitamins was taken by DL in very high doses as recommended by a very incompetent practitioner. In just few weeks, it caused her to start urinating uncontrollably, dozens of times a day. It also caused her to develop anorexia. It caused her belly to become swollen, her skin to become orange, and her bones to break. What happened to DL kidneys and bones when she started a megavitamin therapy? At physical examination, the medical staff at the Columbia Presbyterian Medical Center found out that DL's skin was not just orange but also very dry. Her nails were fractured and a fluid buildup in her abdomen was also found, which was causing her stomach to be swollen. This could mean that DL liver was damaged, but blood tests indicated that liver function was instead normal. DL creatinine was, on the other hand, too high at 4.1 mg per DL, indicating that her kidneys were taking damage. But this creatinine level didn't explain her symptoms. After further examinations, the doctors were finally able to find a clue. DL was suffering from hypercalcemia, or very high levels of calcium in blood. They didn't find, however, any vitamin level to be too high. Instead, it was revealed that DL was dehydrated, which is consistent with her profuse urination before falling into coma. There are now a few clues for what is causing DL to go into coma. Anorexia. Fluid in her abdomen, brittleness of her bones and nails, skin that became orange, very high calcium level in her blood. The doctors also knew from DL husband that she was undergoing a megavitamin therapy. He didn't know, unfortunately, which or how many vitamins she was taking. Which vitamin sent DL to the emergency room? Now guys, if you can tell which vitamin is causing all of DL symptoms before our doctors came up with a diagnosis, write the answer down in comment section. The vitamin DL was taking is the most dangerous vitamin there is, especially for someone with kidney problems. We will follow her medical team as they try and diagnose what is causing all of her problems, but if you can guess at any time which vitamin is the culprit, write it down. It's clear that DL is suffering from hypervitaminosis, and that's responsible for her liver and kidney damage, her hypercalcemia, and her broken bone. The doctors knew that no water-soluble vitamin could have caused all of her troubles, mainly because water-soluble vitamin cannot stay in the body for too long since they get excreted in the urines, and all the vitamin levels in DL blood were regular. This leaves us with 4 vitamins: vitamin A, vitamin D, E, and K. Vitamin E toxicity hypothesis was also discarded because vitamin E has a strong blood thinning effect, and DL wasn't suffering from any bleeding. Vitamin K was also discarded because vitamin K is used by the body to bind calcium. DL calcium levels would have been too low, not too high. Now, both vitamin A and D are linked to calcium metabolism. Both vitamin A and vitamin D can cause calcium levels in blood to be too high. But only one of these vitamins will cause the skin to turn orange and liver and kidney toxicity. Have you guessed which one? Now guys, we will see if DL was eventually able to make it in a moment. As I was saying, this video is a cautionary tale. It's not uncommon to read in medical literature about people erroneously recommended to do therapies that cause more harm than good. And in many cases, medical practitioners that are not supposed to prescribe any drug at all, such as a chiropractor, are the cause. We have also seen that happening in my video about aristolochic acid. That was a very unusual case study. A woman progressed from normal renal function to advanced renal failure and end-stage renal disease in just 8 months. She needed a transplant after that. Her kidneys never recovered. According to the documentation, 5 months before the start of the symptoms, the woman took herbal medicine for pain relief, and that herbal medicine was prescribed to her by her acupuncturist. This video is up here if you miss it. And while vitamins are usually safer than herbal remedies, many people take them in doses that are way above the recommended daily allowance. This is what megavitamin therapy is all about. Megavitamin therapy is the use of large doses of vitamins, often many times greater than the recommended dietary allowance, in the attempt to prevent or treat diseases. And it was eventually found out that what caused all of the DL problem was exactly that. It was eventually performed a transjugular liver biopsy on DL. In this procedure, a catheter is placed through the jugular vein in the neck, guided through the heart and down into the liver, where a sample is collected. What was found confirmed the doctor's hypothesis. DL had an increased number of fat-laden stellate cells, meaning that vitamin A had been accumulating for some time in her liver, engorging the cells, causing them to die and form scar tissue inside the liver. This means that DL was experiencing vitamin A-induced hepatotoxicity, and that the megavitamin therapy was slowly destroying her liver and kidneys. And as I was saying, vitamin A is extremely dangerous for someone with kidney disease. It is crucial for someone with CKD to never supplement vitamin A. As I was saying, if the kidneys cannot remove this vitamin properly, toxicity and damage to organs are even more likely. And even if DL didn't have kidney problems before her megavitamin therapy, she took enough vitamin A to damage her kidneys too. But the doctors were more worried about her hypercalcemia. It required therapy with mithramycin. This is an antibiotic that also used to treat cancer and to bind to excess calcium in blood. Okay, do you want to know how it ends? Did she make it? Let's see. After the second treatment with mithramycin, her calcium levels stabilized in the normal range and DL was eventually able to exit the coma. The problem with vitamin A is that there is no way to remove it from the liver, however. Doctors were able to treat her fractured bone. They were also able to drain the fluid in her abdomen. But there is nothing to do about excess vitamin A. This is why her calcium levels kept rising during the next months. She was eventually discharged and recommended to immediately stop the megavitamin therapy, which she did. She was also being monitored as an outpatient for her liver and kidney function. At discharge, nail and skin problems were beginning to resolve and the swelling in her abdomen was diminished, indicating some recovery of liver damage. But her calcium levels kept being too high for several months. Her liver disease progressed with the development of further swelling in her abdomen. But clinical evidence for improvement in other areas was appreciated by a gradual return of muscle strength and improved mental status. She was able to gain some of her weight back and eventually she made a recovery. Guys, I hope you enjoyed this video. If you want to watch more like this one, this video up here may interest you. And this is all for today. Thank you for watching. God bless.